Good morning all. My today's presentation is on ULCER and my name is K. Sarana Srinivas. Case summary, 72-year-old Miss Sumati residing at Nagarkoil belongs to lower middle class came with complaints of ULCER in the dorsal aspect of left foot for 3 weeks after sustaining a trauma from the bedpost which started as small ulcer and gradually progressed to present size, and a history of discharge is present and she is diabetic for the past 25 years and no other comorbidities present. Examination of the left foot. Inspection. Attitude of the limb is normal. Limbs are bilaterally symmetrical and no shortening of limbs are present. No deformity is present. A single ulcer of size approximately 3 into 3 cm is present on the dorsal aspect of the left foot. Irregular in shape. It extends anteriorly 3 cm from the proximal end of the first metatarsophalangeal joint and 5 cm from the ankle joint. The margins are regular, edges are sloping, and the floor is formed by a healthy granulation tissue medially and tendon laterally, and the serous discharge is present. The skin around the ulcer is hyperpigmented and an yield ulcer is present and no dilated veins are present. All inspectory findings are confirmed by palpation and no warmth around the surrounding area.
Can you show the picture of the ulcer once more? And just wait, we want to have a look at it.
No warmth around the surrounding area. Tenderness is present. A base is not indurated and no palpable regional lymph nodes. Examination of the peripheral pulses. Dorsalis pedis artery, posterior tibial artery, popliteal artery, femoral artery. Here all there are normal pulses only. And examination of the nervous system. No loss of sensation over the foot bilaterally. No muscle wasting. Deep tendon reflexes are normal. Diagnosis: a case of traumatic healing ulcer in the left foot exaggerated by diabetes.
So this is a ulcer of only 2 weeks duration.
3 weeks.
3 weeks duration. The trauma was
Due to the same thing.
it is initiated by a trauma.
Yes, sir.
So any other complaints of the patient, whether he is hypertensive?
No, sir. No other.
Only diabetic.
Only diabetic.
Since how many years?
Since 25 years, sir.
25 years. Is he on medication?
Yes, sir. Regular, sir.
I think any ulcer in this area will take at least 2 to 3 weeks to heal, isn't it?
Yes, sir.
Only the patient is having a diabetes as a complication. What are the other conditions which may retard or slow down a healing process?
Sir, if there is an infection around the ulcer, or there is an hypoxia,
Or factors affecting wound healing?
sir. General factors and local factors. General factors like local factors like hypoxia, poor blood supply, and repeated trauma, or due to infection, or not proper cleaning or not proper dressing.
No, your patient doesn't have any vascular compromise. So you are examined, isn't it? But can any foreign bodies
Yes, sir. Can also affect wound healing, sir.
or yeah, I can see one sinus there on top. What is that? Is it a sinus or is it another ulcer? Or
That is healed.
Yield ulcer, already yield ulcer, sir.
it was there before or it occurred simultaneously?
It was in the past, sir. It was there before, sir.
Even before the trauma?
Yes, sir.
Even before the trauma?
Yes, sir.
So did you examine the other limb?
Yes, sir.
Hmm.
Another limb, there is no any issue of any ulcer, sir.
Any ulcers? So what is his profession?
Sir, she's a homemaker only, sir. Housewife only, sir.
Housewife and homemaker. Okay. Right. So here also you have to compare with the other limb. On examination you have to measure out the limb, the circumference, thigh circumference. So in ischemic limbs or in diabetic limbs, you can get atherosclerosis and ischemia. He's an old patient, isn't it? 72 years, isn't it? So atherosclerosis, etc. can produce muscle wasting. So are any signs of ischemia in this limb?
No, sir.
There is no signs of ischemia. What are the signs of ischemia?
Sir, dry skin, pallor, loss of hair, and
What about the hair?
loss of hair, sir.
Hair will be scanty.
Yes, sir.
Oh, whatever is
Fissure of nails present.
whatever is less important, the limb will discard those. Hair will be discarded. The subcutaneous tissue will be lost. Finally, the muscle will get wasted. And when it progresses too much, only the nerve will be involved, isn't it? So anyway, if any blood supply is compromised, etc., you have to measure out. Even otherwise, you have to measure out if there is a chronic non-healing ulcer. Because the causes are diabetic, old age, atherosclerotic, peripheral occlusive vascular disease. Everything should come into your mind. How did you palpate for the blood vessels? Pulsations.
Sir, for dorsalis pedis artery, we should look for the artery at the top of the foot, just before the intermetatarsal.
You started
space.
from below or started from above the limb?
From above, sir.
From where? Which pulsation did you palpate for the first?
Femoral artery, sir.
Femoral arteries first.
Then popliteal artery, then posttibial artery, and then dorsalis pedis artery, sir.
You won't look for anti-tibial?
And since dorsalis pedis artery is palpated,
So you have to look for anti-tibial also.
okay.
Dorsalis pedis is present in all the individual?
It is absent in
10% it may be absent. So you have to palpate the anti-tibial. Okay.
Yes, ma'am.
Also. Can you palpate dorsalis pedis in this patient?
Yes, ma'am.
Where will you palpate dorsalis pedis?
The just before the intermetatarsal space, at the intermetatarsal, first intermetatarsal space, we can palpate the dorsalis.
Proximally or distally?
Proximally, ma'am.
Over which bone?
Metatarsal first.
It is difficult to palpate in this patient, but usually in a normal person, where will you palpate? Over which bone will you palpate the dorsalis pedis? Maybe Madam was asking that.
All the peripheral vessels are felt against the bony.
Yes, ma'am.
Here, all the peripheral how to palpate against which bone you are looking.
See, can you describe the inspection findings with this picture?
Sir, we can see a granulation tissue, and also we can see the
See, first site of the ulcer, no?
site. It is at the left foot, and 2 centimeter from the 5 centimeter from the ankle joint, and 2 centimeter from the toe, sir.
Oh, what next? You continue.
And sir, we can see a bluish area around the ulcer, and also a whitish area which is formed by the scar, which was a scar. And
See, that is not the way that you present, no? After the site, what is the next thing?
sir, size, shape. The size is like circular in size is like 3 into 3 in centimeter, and the shape is circular, and then edges like sloping, and in floor we can see a granulation tissue, and also extends our digitorum brevis muscle, and then the tendon we can see and then sloping edge is seen, and the healthy granulation tissue is seen in the red edge, and also in the area surrounding it we can see a bluish area and then white area, sir.
So can you come over here and show the bluish area as well as the whitish area? The whitish area, you mentioned 2 or 3 colors, no? Just, and also show us where the margin. In the inspection you said margin is irregular. I did not understand what it was. You can show.
Margins we get
You can show the margin. You said it is regular. I did not understand what it is. What did you mean by margin
Sir,
is regular?
margin is margins well and ill-defined margins, sir, and in well-defined we can get a regular and irregular.
Can you show the margin in this picture? And where is the edge?
Edge is like between the
In the picture you can show.
What is it?
edge is between the floor and the margin,
Here, it is
sloping.
a slope. You show it.
Yes, in the edge you can see a purplish color. What is that? Purplish color is there, no?
It is
The pink color
growing
is that. What is that?
epithelium.
Huh?
It is a growing epithelium in the margin.
Yes. So what type of ulcer is this one? Is it clinically? Is it
Clinically it is a non-specific.
clinically? That is the pathology.
Clinically it is an healing ulcer, sir.
Huh?
Healing ulcer.
It is a healing ulcer. Very good. So what else do you want to know? What do you say about these inspection findings? It was good that you talked about the ulcer, the surrounding area.
Surrounding area.
What all
it is
things will you look for in the surrounding area?
Sir, in tenderness or any warmth.
In inspection, maybe.
In inspection, we look at the color, sir. We look at the color, hyperpigmented or hyperpigmented.
What else can be there?
Whether it is spreading or not, we can.
No. Closely have a look at it. Is there any sinus openings? Any dilated veins?
No, sir.
Any scars?
Yes, sir. Scar tissue is there, no, sir.
Where can you show me the scar tissue in the surrounding area?
Surrounding the ulcer, in the
Surrounding area, can you find any scars?
sir, in the top also you can.
Yes. Any other ulcers? Please have a closer look. Is there any other ulcer in the surrounding area?
Sir, an old healing ulcer, old healed ulcer.
That you marked it as a scar, no?
Yes.
That is already healed. Is there any other ulcer in the surrounding area? No. What else will you look in the foot?
Any
The patient is diabetic, no? So there can be some changes in the foot. What changes do you expect in a
any
diabetic patient?
edematous.
Diabetic as a complication, what all changes can be there in a diabetic foot?
Uh,
In a diabetic, this patient is diabetic, no? So some changes can happen. Not in every patient will it happen, but in some patients it can happen. What are those changes? And are those changes present in this foot? Can trophic changes happen?
due to diabetic.
What are those changes?
Trophic. In trophic, we can. It is due to diabetic. It can occur due to diabetic neuropathy.
How does it? Can you explain how trophic changes can be there in the foot? What are the changes? The digits will be having some deformities. What are those?
So, claw toes can be seen in diabetes.
Yes, very good.
Deformed due to Charcot's neuroarthropathy, we can get joint deformities. We can see.
Yes. What will it cause? Outwardly, what will the appearance be?
Claw toes. Extension of the.
Have you heard of rocker bottom foot? It's a rocker bottom. You know what a rocker bottom shoes is, no? You're not new gen? You don't know rocker bottom shoes? Dancers use it for rocking. This shaped bottom. So you said it is a traumatic ulcer, no? Can it be an ischemic ulcer?
No, sir.
Why?
Like we use that investigation arterial Doppler is used to like look for any
Clinically.
clinically. It is painless, ma'am. Arterial ulcer are pain.
Okay. Now this question is open to you. Can this be an ischemic ulcer? Yes or no? No. Right. Why?
By inspection.
No, let them answer generally, madam.
One of you stand up and tell, pa. One of you stand up and tell. Healthy granulation tissue. And what about the edge? Sloping. Signs of healing is present, no? What about the arterial ulcer? What is the color? The granulation tissue color? It's a very pale, no? How to manage the case first?
How will you proceed with the case management?
Sir, glycemic control and cleaning and dressing, sir. And
No investigations required.
If he asks us about management, you have to start with the investigation.
Yes.
How many times we have told you?
Ma'am, we look at the total count, RBC count, and differential WBC count, platelet count, and also the blood sugar, fasting and the postprandial blood sugar level.
Why is a local X-ray? What is the indication for a local X-ray?
Sir, if the bone or joints are involved, we have to.
What involvement do you expect?
The clot toes we can look at
When an ulcer actually fails to heal
it will.
with maybe some sinuses, we saw one sinus there. What do you expect? Especially in diabetic patients, neglected patients.
Arthritis, osteoarthritis,
Pardon me?
osteomyelitis.
Osteomyelitis. Yes, osteomyelitis, sequestrum, etc. Isn't it? Sequestrum acts as a foreign body even. Okay. Proceed.
Then we'll take the culture and sensitivity, sir.
Yes.
Of the discharge. And then X-ray, AP, lateral view, and chest X-ray and ECG. We'll do that for any tuberculosis if present.
ECG for tuberculosis.
Chest X-ray, sir.
Yes. So, do you want to exclude a malignancy in this ulcer?
Yes, sir.
Want to exclude?
Yes, sir. For that veg biopsy we can use, sir.
What is the duration?
Duration is like 3 weeks for this.
3 weeks ulcer, you will take a biopsy.
No, sir.
Then we are telling. Is it a need for to rule out malignancies or is